Welcome to Treasure Coast Community Health, with 7 locations to serve you better. We have a dedicated staff. And now, here's your host, CEO Vicki Soulé.
Hello there, and welcome to Community Conversations. I am Vicki Soulé of Treasure Coast Community Health. Many of you may have seen me in the newspaper on various occasions, but I have to say that today's guest is probably even more infamous than I am, and that would be Teddy Floyd from the Indian River County Sheriff's Department. Teddy and I, like many of you, go back a ways.
Yes.
And unbeknownst to me, though, after we did testing for COVID virus on Teddy and his family, he was hospitalized. And he has indicated, although he is, like many of our guests, a little nervous about talking to a microphone. I've reassured him that this is just a regular conversation. And he has a message he wants to relay. And so I've invited him to be present today. And welcome, Teddy.
I'm glad to be here.
Well, I know you are. You're a great community asset to us. And being willing to share your story for the betterment of others just goes along with your personal code.
Yes.
And between you and me, I saw you saying that little prayer before we started.
Yes,
so that God would make you strong to say the right things.
Yes.
And I know you will. So, Teddy, you have seen us do testing at the fairgrounds for many weeks now.
Yes.
And I believe that you were probably in that batch, as it were, that large number of people who started coming in July for the free testing at the fairgrounds. Tell us about that experience and what drove you to get the testing.
Well, you know, as a police officer, I've been doing this 31 years for the sheriff's office, and I work in the community affairs and school resource unit. And you're seeing people get this COVID-19. And, you know, you're seeing it going through the community, people not wearing masks or doing whatever. So when I actually went and wanted to get tested, and you guys tested me first. And when it was, we were clear. But as an officer getting involved, I came in contact with an individual who had it. And not knowing at the time, knowing all the stuff that you've taught me, watch, social distance, I'm hard-headed as a police officer. And but I caught it.
It's tough talking through those masks. And I do want to say to those that see us on Facebook that here in the studio, we remove our masks just to have this conversation, being socially distant. As soon as we are out of this room, our masks are back on and in place because we can't assure that we will have at least a 6-foot separation with others that might be in the studio.
That's right.
But we want our message to be clear, and so we are doing the inside social distancing or physical distancing. And, you know, to Teddy's great benefit now, we hope he's immune since he was hospitalized with a very serious case of it.
Probably the most shocking thing in my whole life, besides, you know, getting married and having a kid. But, you know, I want to give a nice shout out to Cleveland Clinic and you guys and TCC because all you had to do was go and get tested. Lines might seem a little long in the beginning, but they're sped, they're expedient, they work fast, and it's worth it. I'm telling people, please, I'm begging, because I was in the hospital for 3 weeks, and I was on a ventilator, I was breathing, I was begging, and I was panicking. It's a long time. Yeah. And when you're in the room, it doesn't hit you till late night, and you can't hear your wife or your family, and it's just this thing over your shoulder that's got you clocking your heartbeat and your breathing, and you can feel, and you couldn't breathe. At one point, I couldn't do that. And I'm telling you, if I could ever say anything to our community, now is the time where we're in the fork of the road where we got to do the right thing. TCC saved me.
And you were really very vigilant about wearing a mask.
Yes.
But sometimes, particularly in law enforcement and in healthcare, the up close and personal is the mask is insufficient at that point.
That's right. Because everything is split second. Everything you do from 0 to 60, boom. And you got to make I had a subject and, you know, a young man I was trying to save, and he had it, coughing and everything. And I had to make a split second because he was breaking the law. But as a heart, hey, let's give you a chance. Nothing we can move, no felonies. But the fact was, he was coughing in the vehicle, and I, had a mask on, didn't do everything I was supposed to do.
And the ripple effect, as you told me earlier, was that when you got tested, your whole family was tested.
Yes.
And they were all positive.
All positive.
And that exposure was not weeks and weeks earlier.
No, it was just 24 hours.
Wow.
Within 24 hours, it spread through my family. My wife, my kids, every one of them were affected. And then I had to really separate myself from them, even though they were tested. And I went to the hospital. Then we have another house, so I had to go there to self-quarantine to make sure, and go back and get retested by you guys again, negative. But
Yay.
Good. Yay.
But that's the best thing about the testing. Yes, there's lots of imperfections about it. We can argue until the sun comes up and down a couple of times.
That's true, right?
About the validity of the test results, the data that we're hearing. But there is so much that we don't know about this virus. Why would you not want to take the high road and protect yourself and your family?
You know what? Without going through and knowing, I'm pleading to our community. It's worth it. You're fighting an invisible killer, and you can't do anything. I'm a police officer, and I'm helpless against this. Our community, as you said before, don't know enough about it. If it's hitting from White House all the way down to the NFL teams to locally, look at our death rate in our community. You walked in the ER the other day, every other person had COVID. Wow. So please listen to what they're saying to you. I'm a witness.
As a percentage, the statisticians say, it is less than half of 1% of people who contract it actually are succumbing to the disease. And that is less, perhaps, than other diseases. But the reality is every one of those lives is precious to us. And it's not just the old, the obese, the blacks, the Hispanics, it doesn't recognize any of those things.
No color. Factor plays into this.
That's right.
If I had to sleep on my stomach, and I was trying to do it, and I couldn't breathe on my back, and one of the nurses said, I caught it way back when, Teddy, and I had to turn over, and she made a world of a difference with that. And to our community, if you don't have to be out, don't be out. A week ago, I went to a party, no mask, nobody had masks, they were just, and I understand it. I was young at one point, but when there's a killer in your community, and I'll tell you, from a person that went through it, I would be safe. I would do everything, sanitize. I would wear a mask at all times. I would wash and social distance at all times. And if I don't have to go anywhere, stay home.
Now, Teddy, do you think, and I know that a lot of people have chosen not to go out to churches, which is a very integral part of their life.
Right.
So I know that they are making those sacrifices.
Right.
But if you had to think about barriers to doing that, are there not enough masks available for purchase? Is that a part of it?
No, we got everybody from you guys to all the local organizations. There are people that have given. I want to give Faith Thornton. She gave out 2,000 masks. Jimmy Graves Foundation, from different organizations within the community, were giving masks. There's an opportunity for you. You just got to take advantage of it.
And Faye's got another one coming up this next weekend.
Yes.
I don't remember if it's Saturday or Sunday. I think it's Sunday.
I think it is Sunday.
So, again, she sets up right on 45th.
45th.
Yeah, can't miss it.
Drive through. All you got to do is grab a mask and keep going.
And then wear it.
And wear it.
And
That's
wear
it. Wear it.
Okay.
It only takes a few minutes to just put it on. And it's, unfortunately, I think this thing is going to be here with us for a while. So we might as well get used to it. It's common as a flu or getting a cold. So we need to make sure that we protect ourselves at all times.
And we're going to talk after we take a short break from our sponsors about some of the long-term ripple effects of this whole COVID thing.
Yes.
Okay. Thank you so much for being here with us.
Thank you for being
We'll be back in just 2 minutes, folks.
10, 9, 8. Why did the countdown stop? Because it's the countdown to Buzz TV channel 1098, Comcast Xfinity, and it's here. Local content for Sebastian, Vero, and Fort Pierce. Tune in for local info, happenings, and fun, including all the great Planet Vero TV shows from 8 to 10 a.m. and p.m. Dial in channel 1098 for Buzz TV on your Comcast Xfinity box and discover what the buzz is all about.
Is owning a home your goal? With the rising cost of rent, you could be saving a lot of money by owning your own home. At Caliber Home Loans, we can help make home ownership a reality. Meet with us for a free consultation and get on the right path to buy the home of your dreams. For Caliber, home loans is all we do. We use local appraisers and offer a variety of loan options to fit your lifestyle and budget. Call us today, 844-GO-CALIBER, license number CHL15622, CaliberHomeLoansTreasureCoast.com.
Why did the countdown stop? Because it's the countdown to Buzz TV channel 1098, Comcast Xfinity, and it's here. Local content for Sebastian, Vero, and Fort Pierce. Tune in for local info, happenings, and fun, including all the great Planet Vero TV shows from 8 to 10 a.m. and p.m. Dial in channel 1098 for Buzz TV on your Comcast Xfinity box and discover what the buzz is all about.
Hi, I'm Vicki Soule, CEO of Treasure Coast Community Health. Treasure Coast Community Health has been serving Indian River County for 25 years. How did we get here? It took a commitment to you to provide you with the most affordable, high-quality, integrated network of healthcare available anywhere. It took board-certified doctors and dentists and a dedicated staff to ensure that you receive the best possible care. It took more locations to meet the need, and now TCCH has 7 locations, with the latest one conveniently located down the street from Cleveland Clinic Indian River Hospital. Our services are available to everyone, whether insured or not, and at TCCH, no one gets turned away due to an inability to pay. We rely on donations from generous benefactors to continue our much-needed work. We accept Medicare, Medicaid, and almost all insurances. Call us at 772-257-8224 or visit us at tcchinc.org. Community Conversations. That wasn't my usual return to music, but that's okay. This is Vicki Soule at Treasure Coast Community Health's Community Conversations. In case you're just dialing through, stick around for a couple of more minutes because today we have Teddy Floyd with us.
Yay,
Yay, Teddy. Everybody knows Teddy. Teddy, how long have you worked at the Indian River County Sheriff's Department?
31 years.
Wow.
I've been there a long time.
You've probably done just about every job in there, too.
Yes, ma'am. I get involved.
But the one you like the best is the ones where you get to talk about involvement.
That's right. Community,
kids,
policing.
community, yeah?
Yes.
Okay. So now you switched this year to school resource, but you mentioned that you are also working with a kids' football team.
Yes. Yes, Vero Beach, one of the best in there. Vero University, as I call it.
All right. So those trainings are still ongoing,
Yes.
although you've had to make changes to that as well.
Well, I want to give a shout out to and a thank you to Coach Jay because the pandemic has changed practices a whole lot. Our kids are social distance. We're 6 feet. Where we would have a bunch of kids in
all lined up.
We can't. We only allow maybe 6, 7 workout, wiping down the weight room, keeping sanitizer, disinfectant, constantly wearing masks within it. So it has changed.
It is a real fine line, though, because,
yes.
The approach to this unknown disease can be anything from forget about it, I'm done with it, it's just fake news anyways, to I'm not going to go out of the house, my kids aren't going to go out of the house, and whether it's 5 months or 5 years, that's my job as a parent. And then there's a whole bunch, I'm guessing, including the parents of your sports team,
Yes.
that are in the middle saying, we've got to have a balance in life.
Yep. A lot of the parents are caught in between. But, as again, we do the basics. They get tested, their temperatures checked, they social distance. We're wiping down the machines. We're constantly talking about safety.
And they're wearing masks while they're practicing.
So you're trying to do everything we can. Even as coaches, I have another shield that fits over this mask.
Okay.
So I got a shield mask. and to really try to keep exposure down. We're doing everything we can.
Well, there's so much that we don't know about this that taking precautions is certainly the smart thing to do. But kids are only kids once.
Yes.
And they've given up some. Parents will say that's better than giving up their life. So it is a personal decision that has to be made.
It is.
But I'm really impressed with how the various schools have come about with the 3 different factors. And the parents, interestingly enough, I'm sure it wasn't planned, about half of the kids are going back physically to school, which allows for the social distancing within the schools. Half of that half are going virtual, and half are taking the wait and see approach, doing the online courses. So it really has worked out according to God's blessing in that way.
It is. It's been a blessing. And to watch all of the teachers, I want to give all the schools and Dr. Moore for advocating safe distances, sanitize. If you go in every room, there are placards all over the school. There are rooms that indicating there is hand sanitizer here. There's a mask there. They're doing every precaution they can for our kids. And like you say, for the other half that are home, that gives the parents a virtue that my kid is home and he's safe.
Well,
So
there's all different situations at home as well. As we know, some of us have multi-generational families where we have someone who is older, maybe immunocompromised, and doesn't have a great immune system. So, this variety, this creative challenge that we've all been under for these many months has really brought some interesting things to bear.
It is.
And I'm hopeful that people will start to or continue to be flexible and understand that one size doesn't fit all.
That is. And that's the key. Being understanding that we're facing something we never faced before, and being able to adjust to it. Also, when you go through something, I know that, you have your family and you calmly just say it's just family. But when I went through what I went through, and seeing our community go through it, it brought people closer together. So it gives you time where you can social distance, but you can talk at the table and talk about the issues and what can we do to make our community safe. Or there are a lot of advocates in the community. I want to say again, besides TCC, there are guys that are encouraging. If there is time to get free testing, go get it.
Yes, please.
Get your cup of coffee, get yourself and come on.
Well, I was going to say, now the lines are gone.
Yes,
okay?
they're gone.
It is zip through, drive through testing, and the results are coming back in 2 to 3 days. So the reality is that despite all the conflicting appearing articles in the newspaper, I was looking this morning, it was like on the front page they say things are getting great, and on page 3, not so great.
Yeah.
It's hard to know what to do when you look at that media approach, but your gut check tells you what to do and take advantage of the fact that testing is available.
We need that.
And, some of the tests are creating false positives, but better to think that you have it and isolate and not expose others than to think you don't have it, don't need the test, and are unfortunately helping spread it around, because it does affect some people greatly, as it did you.
Yes.
3 weeks off of work and in the hospital, and you're probably still not feeling 100%.
No, it's just that I got to drive to continue to get this word out. I want to thank TCC. Thank you, Vicki, for making those tests so available to our community. And to our community, come out. If you've been in doubt, go back. Get retested. Give it a couple of days and go right back. Because you cut down that exposure, no lines, speedily, and the staff is great. You get a conversation. They want to help you. This is what we're telling our community. Come out.
Well, and, I'm going to add on to that, because while all of this attention has been on COVID, and as you've said, if you don't need to go out, then don't. I have to add a PS to that. If you have a chronic condition, if you have high blood pressure, if you have diabetes or even pre-diabetes, if you haven't been to the doctor in 6 months to a year, you need to make those appointments and go to your primary care physician. I'm reading article after article of concerned individuals, not necessarily private docs that are looking for the business, but scholars who have watched and read and learned about these things. And they are anticipating that we are going to have such a ripple effect down the road with our children not being immunized. We conquered measles, mumps, rubella, polio. But that was through immunizations. If the kids don't continue to get their shots on time and regularly as they're supposed to, we are going to see them succumb in groups to this. We saw it. We had a highlight of that over in Tampa. A whole sports team at one of the universities was put out of action for a month because they had a childhood disease hit these 18, 19, and 20-year-olds.
Yes.
That will happen if we aren't vigilant with our children. It's happening with our adults as well. We're seeing that they're not coming in for the preventative screening. So colon cancer, mammography, pap smears. The list is not all that long, but it is vitally important.
It is. It is. Every underline that something that may be going in your body, please go and get it checked.
Yeah. Telehealth is great, and I'm so excited about some of those positive things that have resulted out of this. You know, if you don't have rain, you don't learn to appreciate the sunshine kind of thing.
Oh, I got you.
You know, so it hasn't been all doom and gloom. This technology, telehealth, a lot of the Zoom meetings that, you know, kicking and fighting, we came to the table and said, well, if I want to see people, I guess I'm going to have to learn it.
Yep.
And we have, and we've done it successfully. But I cannot encourage people enough. The physician offices, the dental offices have done what they normally do to the nth degree. They are doing everything possible. And there's no guarantee in life. Yes, maybe you know somebody who knew somebody who knew somebody else who claims that they contracted the disease by going out to one of those offices. But there are people being hit in car crashes every day as well.
There it is.
You can't bubble wrap your life. So you have to do what science has proven to be beneficial to you. That's why we're wearing masks. We're socially distancing. We're using alcohol wipes all the time. And it is proving to be beneficial. I'm asking people to please make appointments with your primary care physicians. If you're socially distancing at home, that's great. But don't ignore the rest of your health. That is a huge problem in our community and all across the United States. So I'm not a solo voice in this.
No, I advocate it because for all our first responders, essential workers, my heart goes out and I thank you. When it wasn't until I was in there and I saw this, what our staff did at TCC, and you get over to Cleveland Clinic, and they're working constantly. Running.
We want to keep the community healthy.
Keep them up and going.
But we need your help in doing that as well.
We do. We need you to do what you're supposed to do.
Yeah. So our dental offices have reopened for those people. We've always taken the emergencies all through this battle.
Yes,
but again, if you have a toothache, don't neglect it. It's not going to go away.
Nope.
And we may be able to save that tooth as opposed to seeing you 2 or 3 months from now having to have it extracted because it's totally rotted.
That is.
Likewise, mental health, there's a lot of great providers in town that are willing to help you work through some of these issues that maybe you don't get the support from your families, or maybe your family is the problem. We talked earlier just very briefly about domestic abuse as you and I were coming in. Sometimes home isn't a safe place.
No. You need to seek others outside. And a lot of times, even as an officer, you need a third party, you need counseling. It is here. We got avenues for you and for the family, but you got to first realize it. Look yourself in the mirror and say, I need help. That's the biggest thing. And when you do it, we got everybody. We got everything at your fingertips to help you.
So if it's not a 911 emergency, 211 is the place to go.
211,
okay.
Yep.
And if you're not sure, 911 is there.
We'll point you in the right direction.
All right. So you don't get upset if there's like, why were they calling us about this?
Because people, and right now we're in a state of emergency, people are panicking. They don't know. A kind word and point them in the right direction. And if you see me, Deputy Floyd, or in our deputy, hey, where can I go get this? They're constantly giving us resources to try to help our community.
Well, thank you, Deputy Floyd, for telling us all about your experience and giving advice to the community from a heartfelt position based on experience.
I'm just glad to be alive. When you're in that room and you have all this stuff hooked up to you, it's not until that point we want to thank. I probably wrote you a million letters straight telling you and the staff thank you because I thought I was going. So,
well, thank you for sharing, and thank you all for being with us today. Next week we'll have another great community speaker here today. Is Teddy. We'll be looking for others. If you're interested, give me a call, give me a shout out. Thank you and good night.
Come get tested.